Now, the people of America are in the middle of a mental health crisis, a crisis that has existed in this country for years, in my opinion, but has undoubtedly been worsened by the stresses and tragedies of the pandemic. And for clarification, I'm talking about mental health, not mental illness. Per the CDC, mental health includes our emotional, psychological, and social well-being, affecting how we think, feel, and act. And per the American Psychiatric Association, mental illnesses are health conditions involving changes in emotion, thinking, or behavior, or a combination of these. They're not the same, but poor mental health can lead to mental and physical illness, which is why it needs to be addressed on all levels of society, particularly among our young people. Now, of our young people, now if you know me, you know mental health care is something that I firmly believe in. So you can imagine how disturbed I was by a recent report published by Disability Rights D.C. stating that the city in which I live doesn't provide adequate support for its young people dealing with serious mental illness. Disability Rights D.C. at University Legal Services is the federally designated protection and advocacy program for people with disabilities in the District of Columbia and is the client assistance program under the Rehabilitation Act. Their mission is to advocate for the human, civil, and legal rights of people with disabilities in the District of Columbia. Now, the district is required by federal law to provide mental health services to young people who qualify for Medicaid. And under the American with Disabilities Act, they must also receive services in an integrated setting, meaning in-home therapy, mentoring, and behavioral support services. But this doesn't appear to be happening. Instead, young people are allegedly cycled in and out of institutions. Then when they're discharged from a psychiatric hospital or residential treatment facility, group home, or detention center, they're sent back to their communities with no follow-up services, no further mental health treatment, nor follow-up care. And the services that are available have a long waiting list. And then when you do get to the top of the list, the services only come for a limited time. So just imagine how this feels to these young people. Imagine how it would feel to you. You would feel hopeless and abandoned. You would feel misunderstood. You might even feel trapped. And then where do you turn for release? Most likely to someone or something that will be detrimental to you and the people around you. At the end of the report, Disability Rights laid out a map of solutions built around intensive community-based services. So a plan to confront the problem is there. Does the district have enough want to for that? Well, we'll have to see. But one good thing that has come out of this pandemic is a collective willingness to focus on our mental health, which of course is fantastic. But extra attention has to be paid to DC's young people already living on the edges. They're our children too, and they deserve no less than any other.